When patient present with leaking due to premature rupture of membrane, there is always chance of infection. Is this infectious liquor responsible for production of liquor embolism? Yes. This leaking, which doesn't seem to be serious clinical entity initially, may be converted into serious one due to improper management and due to not to be serious for ensuing infection. Because all of this causes formation of liquor embolism. Not need to say this embolism can lead to death of patient reaching up to pulmonary circulation and respiratory system up to respiratory bronchioles. Anoxia causes blood vessels injury and endotoxin releasing from infection causes production of causes provocation of coagulative factors. Endothelial injury with provocative coagulative factors causes DIC, that is disseminated intravascular coagulation in pregnancy. Due to consumption of main component of coagulate or clot, as example fibrin and fibrinogen, vigorous bleeding occurs, which in turn causes shock. Lycomyemny, which is rich in thromboplastin, along with endotoxin of infection, turn in clot formation, which is disseminated later on, which is known as disseminated intravascular coagulation. In in coagulation disorder, plasminogen activators like streptokinase and urokinase activated more than normally, which convert plasminogen into plasmin, which digest fibrin, fibrinogen, factor 5th and factor 7 and break the clot into fibrin degradation product, and in this way there is uh, impairment of clot formation, there is inability to form clot and vigorous bleeding occurs somewhere. To reverse this disastrous clinical situation, as a therapy we should supplement whole blood, fibrinogen and platelets. Besides infection due to leaking of liquor, normal coagulative factors are increased physiologically in pregnancy, which cumulatively causes embolism, bleeding, and shock. That's why we can say leaking is how much serious to have our attention. When patient present with leaking due to premature rupture of membrane, there is always chance of infection. Is this infectious liquor responsible for production of liquor embolism? Yes. This leaking, which doesn't seem to be serious clinical entity initially, may be converted into serious one due to improper management and